All right, guys, we're going live tonight because I really have some true information that I think that's necessary for you to capture. I'm going to say this at the beginning of the video, and I'm also going to remind you at the end of the video. If these videos are helpful for you, share the videos. SOS, save ourselves, it's got to be the motto as this coronavirus and these vaccines are starting to take over our normal activity. Today's lecture is simply regarding the vaccine, the effects of the vaccine, and their willingness or attempt to use it on our kids. And I have 3 children, so it's important that I share with you what I know. Now, Los Angeles, which is where I live, if you live in another area, Los Angeles now leads the United States in the most coronavirus deaths and probably the most coronavirus cases, bypassing the New York. But Los Angeles County now has confirmed 8 of the United Kingdom detected coronavirus cases. Now, LA Times report the first case of the South African coronavirus strand was found in California. This is LA Times. So now we're saying LA has the UK variant and LA also has the South African variant. Just so you know, the variant now through New York Times, the variant that emerged from South Africa is reported in the United States for the first time. This is January 28, 2021. Now, in January, we realized that the South African and the UK virus was in LA. Now, I'm sure if it's in LA, it's everywhere. Now, mind you, people fly in and they stop, but I just want to emphasize the UK virus and the South African virus is here. Now, they're getting ready to vaccinate our children, which is what this conversation is about. In South Africa itself, South Africa stopped using the vaccine for their own variant because they found out the variant was resistant or the vaccine did not work. Let me reiterate that. South Africa tested the same vaccine that they're getting ready to give to our children, and they found out the virus was resistant to the vaccine. So the vaccine did not work for the South African virus. Now, let me show you on CNN where they published and talked about that. Make sure I make it loud enough for you to play. Give it a little second here.
Cause a new surge in the spring. At least 27 million Americans have tested positive for the coronavirus. More than 463,000 people have lost their lives because of complications linked to COVID-19. In South Africa, health officials have paused the Oxford AstraZeneca vaccine rollout after a study found it was not effective against the new variant first detected in the country. I want to bring in
AstraZeneca, the vaccine that we're going to be using on our children, was found in South Africa to not be effective against the South African variant. Now, mind you, in their own country, they said it's not working and they stopped. Now, I don't know if they're saying that South Africans are stupid. Maybe we know more. But the true reality is South Africa did the test long enough to realize that the vaccine for our children did not work and they stopped. Now, America jumps on board. AstraZeneca COVID-19 vaccine is to be tested on children and teens. The same vaccine that South Africa said didn't work, we decide, hey, they aren't smart enough, or some reason, we're going to now test it here in America on our children. I can't say your children because I have children too. On our children, they said, we're going to do the study. It gets even better. AstraZeneca now, COVID-19 vaccine to be tested on children. This is in the United States, updated February the 13th. February the 13th. Now, that's right before Valentine's Day. They're going to use the same virus, the same vaccine here in the United States that South Africa already told you does not work against the new South African variant. Now, AstraZeneca is the only one so far that you can use between the ages of 6 and 17. AstraZeneca, the same one that they're testing here, the same one that was proven in South Africa that didn't work against the South African virus, they're going to now test here on our children. Now, this was updated February the 13th in school-age kids now, 6 to 17. Just in case, Moderna and Pfizer, which is the vaccines that you are aware of, Moderna on January the 14th, Moderna stated that clinical trials on children 11 and younger would not take much longer, but because we have to get some age deceleration, which means they need to dose it down for the kids. So we should not anticipate any trials data in this year of Moderna. Moderna, which is the vaccine, Moderna and Pfizer are the two vaccines they're using on the adults. They're telling you right here that we should not anticipate any clinical trials in 2021. So they won't be ready until 2022. That's Moderna. Pfizer said that they got authorization. This is all on January the 14th, but their authorization is for kids 16 and 17 and adults. They have not truly been authorized at this time to do any vaccines under children, but they just got authorized to do kids as young as 16. Now, you know of at least two vaccines. Vaccine 1, Pfizer. 16 is the age. Vaccine 2, Moderna. Moderna saying we can't start clinical trials until next year because we got to figure out how we're going to bring the dose down enough so it won't hurt kids. AstraZeneca is the only one that can and will be used to vaccinate your children. And it's also the one that South Africa told you. South Africa stopped doing the Oxford AstraZeneca vaccine after they found out it was not effective. Now comes the good part. Here's the good part. LA Unified School District will reopen its first COVID-19 vaccination site this week for school staff, superintendent said Austin Burtner. That's going to happen on Monday. And 25,000 vaccines for elementary schools. 25,000 vaccines for elementary schools. So they're going to vaccinate our children with a vaccine that South Africa, which is their quote-unquote genetic variant of the COVID, and South Africa has already told you or showed you that this vaccine is not working. So what do? They say South Africa didn't have enough people. So now they're going to do a mass group study, including your kids, because these are clinical trials. There's no way in God's name that in January the 14th, when this came out, and it's about 4 weeks until February, they had enough people to find out if it works in children. So what are they going to do? They're going to use our kids as the guinea pigs to see if the virus works or not. South Africa has already tested it and has tested it for multiple months because for them it was survival. For us, it's in our scientific experience. For them, they didn't want the virus to kill them. So what did South Africa do? They tested the virus there so they could survive. Now, to make the story even better, we didn't get the virus. We come over here and say, now we're going to use the virus here in America to get our kids back to school. Now, here's the funny part. All of a sudden, they decided that the teachers don't need the vaccine. Going back to school for the teachers is not a requirement. That was the funniest thing ever. So we can vaccinate the kids, but the teachers are not a requirement. However, the vaccine for the kids is not working. So what are you going to do? You send the teachers in, the kids give them the South African virus, which I've already proven to you that South Africa, the UK version, is already here, and they're going to die. So you might as well just say we're going to kill our teachers. The teachers union know better, but the literature is not true. But South Africa has enough to let you know that the virus is resistant to the AstraZeneca vaccine, which is also the only one that they've used so far in kids. And Moderna and Pfizer are just trying to get on board and haven't even tested enough in kids. But yes, still, we're going to open the schools and vaccinate our children. That's why I'm saying you need to share these videos. If I'm telling you something that's beneficial to you, you need to share these videos and make sure we help other people. Here's the next thing I want you to know. The WHO, the World Health Organization, CNN, now I took this off of Instagram, but CNN stated the World Health Organization is looking into the origin of the coronavirus in China, have discovered signs that the outbreak was much wider in Wuhan in December than previously thought. And now they're seeking to get information. However, thousands of blood samples in the city, and the Chinese government has not let them examine it. Let me translate. The virus was much bigger in the beginning. This shows you that there's a lot of deception. There's a lot of deception. And the virus also was around for a while and we didn't know. Why is that important? Woman dies after receiving a COVID-19 vaccine at Cal Poly Pomona. This is in California. And they said no links to the shot was suspected. Now, if this is your first time hearing this, a 78-year-old woman was getting a Pfizer vaccine at a Kaiser Permanente COVID site. A Kaiser Permanente COVID site. She then developed, now in the observation, she just got the shot. In the observation, she started to complain of feeling of discomfort, lost consciousness, and according to Dr. Michael Morris, the director of this Kaiser site, the woman then fell literally dead, and they started CPR, and she was not resuscitated. Got the shot, 30 minutes in the observation, and the lady passed away. Now get this. They say there's no link to the shot suspected. The no link to the shot suspected. Now, I do a lot of business in Southern California, South Central, where there's the Crips in the blood. You can't tell me that if a Crip pushed down an old lady trying to take her purse and she died 30 minutes later, he didn't kill her. That wouldn't even fly. You can't tell me if I gave an individual an injection, and mind you, we're not talking about the vaccines directly, we're talking about these deceptions and misunderstandings where they're not giving us the right information, and someone has to tell us. So you can't tell me if I gave a person a shot here in Dust to Gun, and she passed out there in the car, that I want to have an LA attorney and a whole bunch of people sitting outside with a lawsuit. That would be just the norm. There's no way you can give a lady a shot and say you didn't have anything to do with it. Now, this is the part that they use to play with our minds. Let me show you this. They said Her cause of death was yet to be determined, but the Los Angeles County Department, now who is this? Is that Dr. somebody? I have no idea who this is supposed to represent, but they're going to throw out a big name to confuse you. But the Los Angeles County Department of Public Health, who has no name, said by an email, so you know it had to be somebody with an email, there were no signs of an allergic anaphylaxis reaction. Therefore, her death does not appear to be vaccine related. Now get this. He who has no name emailed the news, which in this particular case is LA Times. This is LA Times. By email said that since they didn't have an anaphylactic allergic reaction, which means the mouth didn't swell, the lungs didn't give out, or they didn't get a bunch of welts, that it wasn't a vaccine. So that means if the vaccine kills you differently, the fact that you didn't swell up or you didn't stop breathing, it wasn't a vaccine. There's multiple ways the vaccine could have killed you versus just giving you an anaphylactic reaction like a bee stung you. But she took the shot and 30 minutes later, in the advanced phase, they passed away. Here's some other concerning information. Healthcare worker dies after the second doses of a COVID vaccine. Healthcare worker. Now get this. This guy was an X-ray technician, and he worked here in Santa Ana, California. A couple of hours after he got his second vaccine, he got his vaccine around about 3 o'clock, 3:30 is when he got his vaccine. Now this man got his shot at the hospital. At 3:30, he got his second vaccine. He started having upset stomach and problem breathing. At 7 o'clock, shortly at midnight, at that same day, this man was on a ventilator and was receiving induced coma and receiving ventilation to help him breathe. They then sent him to the University of Irvine Medical Center, where he passed away. The man got his second vaccine at the job. At the job, said his stomach was hurting him, trouble breathing, and 4 hours after, 3:30, I'm sorry, and 9 hours after he was on a ventilator. Now, they said that man had congestive heart failure. But the fact that he didn't swell up and have problems from the vaccine right away, it couldn't have been the vaccine. But yet still, the second vaccine, he passed away. This gentleman, Hank Aaron, passed away after receiving the vaccine. He was healthy up until then. Here's another gentleman, Dr. Gregory Michael, 56-year-old OB doctor in Miami. He died after he got his first vaccine from Pfizer. This is a Pfizer vaccine. These individuals received Pfizer vaccine. Hank Aaron, Pfizer. Vaccines. Each of these individuals passed away, but the fact they say that these individuals didn't swell, the fact that they say these individuals didn't have hives, it wasn't a vaccine. But the OB doctor died from a blood problem. The lady, they tried to say that, oh, she was 78, but isn't that who's supposed to get the vaccine? She had heart problems, isn't that who's supposed to get the vaccine? So they started when she was 78, she had heart problems, so that must have been what did it, because the vaccine didn't make them swell up and breathe. And some anonymous person from the Department of Health said it can be vaccine related. Now, we don't have any real problems with vaccine. I'm just going to tell you, just like a young lady told me. I remember clearly working in the emergency department downtown LA at a place called Good Sam Hospital. And at this location, they would bring people in so I could test what they call medical clearance to send them to the county hospital where they would be arrested. And I remember clearly this young lady looking at me. And this young lady told me, she said, Doc, and she's handcuffed, she said, Doc, I would have went along with anything that man told me had he just been honest. I knew he had a wife, but he lied about his wife. I knew he had kids, but he lied about his kids. I knew he had another girlfriend outside of me. But when I saw them together and he was lying in my face, I lost control. And the reason she was getting arrested because she was trying to run the man over. The truth is, we're okay with what's going on because we know we can't change it. The problem is these deceptive lies. The problem is this untold truth. And you expect us to have you vaccinate our kids when you've done no studies and no tests. You tell the teachers to go back to get a vaccine, and I hope the teachers are hearing this so they can share this information. They go back to school with no vaccine, knowing that these kids are nothing but carriers. My own kids were carriers. I had the virus itself. Now the kids bringing in a virus which is truly here, South African virus, which is more deadly than the initial virus, and the UK virus, and you're going to kill the teachers. They don't have a vaccine, and already it's telling you that the vaccine don't even work on the kids. Who are you vaccinating? Who? I know we need to show some front. We need to make people happy, give us hope, but don't lie to us. You need to share. If this is hitting the bone, you should be hitting that share button just like you were hitting the bell or your iPhones. If this is making sense, you should be letting people know. Save ourselves is what I've been telling you with these videos. Talk to each other. If you have information that's beneficial, you should be telling us because they're not going to tell you the truth. You're going to get misinformation. They give you statements like there's strong evidence that the vaccine stops you from getting the new variants and the strand. Where's the strong evidence? Where's the article for that? Who are these people that's saying that the virus wasn't the cause, that the vaccine wasn't the cause of the death? Why don't they put their name here? And how are you going to say that if we don't come out with an allergic reaction that you didn't shut down my heart, clog up my arteries, like what these guys went through, or do something internally to this man's stomach? You can't give a person, I can't hit you and you die 30 minutes later and we go to court and your family tell the court, well, she was going to die anyway. That don't make any sense. And if we're not telling each other, we're going to believe what this said because it said LA Times, it said CNN. They don't show you that the virus didn't work in South Africa where the people was trying to get it because they wanted to live. They show you over here in America where they want to use this virus on our kids and test it because they need clinical trials. If you give us a vaccine and our grandparents are going to pass away, then that should be part of the program. You should be saying, there's a risk that your grandmother is going to die. Don't have us hoping that she's going to get some vaccine and going to live, and you give her a shot and she pass away. Then we try to stop it so we don't let everybody else go because you got us brainwashed. You should tell us, here's risk factors. We know, I know, that there's going to be consequences. But tell us what we're going into. Don't lie. If you let us know, we may be able to work around it. But when you hide stuff like this, we've already lost trust. We've lost trust. And the last thing we're going to do is let you do this to our children. If you're a real parent. And then, here's the sad part about that. Now they want to open it for kids with disabilities. Well, they must be at a risk. Because they now can have access to the virus before the healthy kids. That makes no sense. These kids can't even speak up for themselves. So you're going to get the autistic kid, the disabled child, and give them a vaccine that you're practicing. So I guess if we lose them, they don't care. Or we don't care. That makes no sense. I'm telling you, you should be sharing these videos. You should be telling everybody you know so we now can start talking to ourselves and sending the message back. Just stop lying to us. Be honest about what we're doing. If you're not honest about what we're doing, then we're going to always have chaos and confusion. And you can't get mad if people start retaliating because they're going to be sick of these lies, especially when you're talking to them about their family. I see this death all the time. Now I remember there was a song one time, and it was a real hit. Let me think of it. What was the song go? I think that's it. Yeah, that sound like that song was. Let me see, now feel it? Yeah. Let me hear it. Girl, you better watch out when people start talking about vaccines. Girl, you better watch out when you can't understand what they're talking about. Vaccines. They hit you with your vaccine. Now your whole scene is a dream. They told you to go get his son, and now they're trying to tell you that your son have autism. They knew grandma wasn't right when she came with you, but now you walk around with her and she truly got dementia. Vaccines. Now, we're not against vaccines. For God's sake, that's not what this is about. The whole truth about what I'm saying is to wake you up and to send a message, if we're fortunate for this to get out, that don't treat us like we're idiots. Tell us if our family is in jeopardy, so when we go for the vaccine, it's okay. Tell us that you have no true studies for our children, so you don't vaccinate, so we force them to go into a public school institution and get sick, and then come home and then do other damage. Just be honest with us. Because see, the truth is, if you're honest with us, we'll work with you. Because we know we're working together. But when you're deceptive, we don't trust you. And if we don't trust you, there's a problem. So we're going to ask you. Come again. Thanks for watching Conversation with Dr. Allen. Share these videos. No one else is going to be telling me the truth. I have an obligation, other than just taking care of you, to make as much noise as I can. And God, I thank you for the opportunity. Conversation with Dr. Allen. Let as many people know as possible that this is a real hoax. Thanks again.